Today I'm going to inform the class on Alzheimer's disease. It is very important that we all know a little bit about this disease because many people around us are affected by it. Alzheimer's disease is a progressive disease that ruins memory and other functions of the brain and can occur in middle to older aged adults. First, I will talk about the 3 stages of Alzheimer's. Second, how someone with Alzheimer's is affected on a day-to-day basis. And third, I will talk about communication tips that we can use as individuals when interacting with Alzheimer's patients. The 3 stages of Alzheimer's are the mild stage, the moderate stage, and the severe stage, which are the early, middle, and late stages. In the early stage, the individual may still function independently. They may even still drive or work. They typically forget what they just read. They forget where they place items on a day-to-day basis. So if they place something in that same spot every day, they may forget where they have been placing it. They have a hard time remembering names when it comes to meeting new people, and they have a hard time with planning and organizing. In the middle stage of Alzheimer's, it is the longest stage, and it can even last for a couple of years. They typically get more frustrated with everyday tasks. They may even refuse everyday tasks such as bathing. They get confused with what day it is or even what time it is. They forget their address or their phone numbers. They have a hard time controlling their bladder and their bowels. They start showing signs of sundowning, which according to Alzheimer's disease fact sheet from the National Institute from 2019, sundowning is a symptom of Alzheimer's disease, also known as the late stage confusion. If someone you care for has Alzheimer's, their confusion and agitation may get worse in the late afternoon and evening. In comparison, their symptoms may be less pronounced earlier in the day. And in the late stages of Alzheimer's, according to the stages of Alzheimer's by Alzheimer's disease and dementia from 2019, the final stage of this disease is the late stage. The symptoms are severe. Individuals lose the ability to respond to their environment, to carry on conversation, and eventually they lose the ability to control movement. They typically need help with all their daily activities and personal cares, even using the restroom. They'll need help getting cleaned up after using the restroom. They're more likely to get infections, especially pneumonia, and they have a hard time swallowing. So there are many very important tips we should follow when interacting with patients with Alzheimer's. 1, remembering what a patient is dealing with. They are dealing with anxiety, loss of self-esteem, confusion, depression. This puts them in a very hard situation when interacting with others. And for us, when interacting with these patients, we need to try to be calm and reassuring, speak slowly, use simple words, make sure we're using our best eye contact that we can use, looking them in the eye, addressing them by their name, making sure we have their attention before we start speaking is very important. And be consistent. If you say you're going to do something, make sure you follow through with it. Some things they don't remember, but a lot of that kind of stuff they do. And the final thing I'm going to talk about is what we can do to allow our communicating even better. We need to, before speaking to someone, address them by their names, asking one question at a time, instead of giving them multiple options, give them 2 options. That way they have 2 different things to pick from and not having a whole list of getting themselves confused. Today we looked at the 3 stages of Alzheimer's, how someone with Alzheimer's is affected on a day-to-day basis, and importantly, communication tips, what we can use when talking to someone with Alzheimer's. Alzheimer's is a progressive disease that messes with the function of the brain and memory loss and can occur in middle to older aged adults.